Hello and welcome to this webinar on physical activity. So today I'm going to be talking about physical activity and the importance of increasing the amount of time that we're physically activity both at work and beyond. And this is part of the series of webinars in this program of Your Health, Your Wellbeing and Your Numbers. And my name is Helen Donovan and I work with another associate in nursing at C3 Collaborating for Health, Lola Kahandi. So C3 Collaborating for Health is a charity with the aim of reducing the risk of non-communicable disease, and that's often because by improving the way we live our lives, improving the amount of we're active, improving what we eat and drink, and obviously stopping things like smoking and alcohol consumption. There's a lot of noise out there if you go online and look to see what's good and what's bad. And what the other part of this work is to try and help you work out what's good, what are the facts and what are the myths with some of this. So one of the things that we advocate is to use the Patient Information Forum PIF tick as your guide. And this gives a really good sense check to make sure that that what you're looking at is current. So there's a date to it. You know that it comes from a reputable source. Just have a think to yourself, does it look professional? Is it trying to sell you something underneath everything else? So as it's sort of looking for you to sort of spend money that you probably don't need to. Is it referenced? Are there sources that you can say, well, yes, I can see where this is coming from? And obviously, are other organisations backing it? So that's another really good indicator that something is good and that you can be reassured of. So today I'm talking about increasing physical activity, both at work and beyond. And this is about understanding the benefits of staying active. And it's about making sure that you think what you can do to keep active on a daily basis. Now, this doesn't necessarily mean going to the gym, it means being active, being present in that. And increasing the amount of physical activity we do. Different types are important. So, yeah, increasing our aerobic exercise, so getting our hearts working a bit more, but also thinking about the amount of balance exercise that we do, things like standing on your one leg while you're brushing your teeth to increase that balance. So when you do go out, if you do have a trip, your body will be able to rectify and you're hopefully not going to have a fall, but also increasing our strength. The health benefits of these are huge, improving both mental and physical health as a way of improving our overall well-being. So staying active, how to incorporate this as part of our general lives. This is a very busy slide. There's lots of stuff on here. But essentially what it's talking about is this mixture of activity and the benefits that they have to health. And this is a World Health Organization recommendation. This is a poster from the Department of Health in the UK and from the Chief Medical Officer. And what it's saying is that really, if we can think about 150 minutes of moderate intense activity in a week, or 75 minutes of more vigorous activity and doing a range of different things. Now, that might seem a lot, but actually 150 minutes equates to just over 20 minutes a day of being moderately active. If you're thinking about 75 minutes, you're thinking about 10 to 15 minutes of more intense exercise, getting your heart going on a daily basis. And there are huge benefits of this. So just 10 minutes or 70 to 90 minutes of weekly brisk walking or moderate exercise really helps. The 10 minutes of brisk walking every day has been shown to lower the risk of early death by 15% because it decreases our chances of developing things like type 2 diabetes, heart disease, dementia, and even some cancers. So increasing our physical activity, using greater ease of everyday physical activities to improve our mood, improve our quality of life, and also, of course, to help us attain and maintain a healthier weight. So this is a little infographic that shows of all of the benefits, reducing hip fractures, reducing dementia, mortality, reducing things like cardiovascular, that's heart disease, and reducing type 2 diabetes. So better physical health improves our muscle and heart strength, mental health support it gives us, lowering our anxiety and depression, and of course some social benefits, because if we are out and about, we're meeting people, it encourages those group activities. So mental health benefits, exercise releases what we sometimes refer to as endorphins, and they stimulate, they're sort of natural chemicals that enhance our mood and make us feel better and more at ease with life. Engaging in physical activity can lower the symptoms of things like anxiety and depression, and regular activity contribute to our overall improving of mental well-being and mental health. Physical health, I touched on before, having attaining and maintaining a good weight, and regular exercise can help us do that. Also, as we've touched on, reducing the risks of chronic diseases and improving overall physical fitness, it enhances our strength and endurance, and of course our flexibility. So what are the tips here? Incorporate movement into daily routines. So if you get the bus to work, for example, maybe try getting off the bus a little bit earlier, just a stop or two earlier, and walking briskly the rest of the way. Sometimes with the traffic, particularly in London, you may actually get to work quicker. And if you incorporate that into part of your daily life. Have a variety of activities that prevent boredom, keep motivation high, and set realistic goals. And I'll touch on this again, but don't set up to sort of run a 5K, walk it first, or walk 2K first, and then build up to 5K. So things that you can do at home, so take the dog for a walk, or if you've got a child, put them in the pushchair and take them walk to the shops, cleaning the house, washing the car, vacuuming the stairs can be a really good exercise. Planting and going out into the garden, again, you're getting out into the open air, mowing the grass. And maybe try exercise to a workout or an app, so you don't actually need to spend a huge amount of money doing this. I mentioned getting off the bus or the train one stop earlier. Maybe try thinking about walking up the stairs at work. Obviously, if you're with a client, you can't do that, or at one of the residents, you can't do that. But walking up the stairs, that uses a really good amount of exercise and helps just keep that 10 to 15 minutes activity in the day. Join in with colleagues, maybe sort of have a little bit of a club where you could sort of do a dance class or a weights class or whatever you fancy doing, and that doing it together helps not just get that sort of group spirit going, but also helps the motivation. And maybe take up something like walking when you get a chance, even if it's just 10 minutes around the block. Swimming, water aerobics, maybe joining a class such as martial arts or Pilates, dancing. And if you want to do something with other people, maybe think about a sport such as basketball or football or something like that. So there's some more tips here. The couch to 5K. So I mentioned don't just sort of try and run 5K, but there's some lots of tips on that about building up the amount of activity you do. Active 10, NHS Active 10, helping you to do that 10 minutes of moderate or vigorous exercise, and lots of resources there on this slide for you to have a look at. So in summary, start small. Be realistic about what you can do. Don't sort of start literally running before you can walk. What kind of activity you actually enjoy? Don't try and do something that you've never enjoyed. I mean, personally, I've never been a sporting person. I'm very bad at catching and playing ball sports, but I do quite like dance and other sorts of exercise. So what's right for you? And what's right for your fitness level? Build up the time you have, use the right equipment, obviously. And sometimes people worry if they have got underlying risk factors, should they exercise? Obviously, ask your doctor or ask your general practice for advice, but really and truly, physical activity is generally safe for everybody. And for most illnesses, it can actually help improve your overall outcome for these physical activities. So thank you for listening. I hope you found this useful. On the end of this slide here, I've got a little QR code, and that will take you through to an electronic online evaluation form. And we really, really value your feedback. So please follow the QR code. Click on the video recording. Obviously, for this one, it's physical activity, and then complete the online form. All of your responses are anonymous. We don't actually know who is giving us the feedback. It just helps us to plan for future sessions and other activities for you. So thank you. I hope you've enjoyed that, and look forward to seeing you on another session.